So calves, unlike humans, are born without any antibody levels in their bloodstream. So it's really important that calves take in the right amount of colostrum at the right amount of time, and it needs to be good quality colostrum. So it needs to be done in the early, just as soon as they've calved, as soon as you can get that colostrum into them. It's really, really important. So the colostrum period, so the colostrum there has a lot of antibody in it, and over those first 24 hours it can be easily absorbed by the calf. After that 24 hours, those antibodies don't get absorbed by the calf's gut. However, continual feeding of colostrum is going to act locally within that intestine to deal with infection there as well. So as far as colostrum is really, really important. So to actually boost the levels of antibodies in the colostrum, the best thing that you can do is to vaccinate with Rotavec Corona. Rotavec Corona contains vaccinal, or it protects against the three main types of infectious scours that the calf may be faced with. So that's the rotavirus, E. coli and coronavirus. So it's really important, if you want to get the best colostrum for those calves, that you vaccinate your cows pre-calving so that they've got boosted levels of antibodies in their blood, which gives them boosted levels of antibodies in their colostrum for those calves to intake. So moving on from there, when do you actually look to vaccinate? Best time to vaccinate these cows is really, if you're doing it on a herd level, 3 weeks prior to when the planned start of calving is. And what that does is that ensures that probably over 90% of your cows are going to have boosted levels of antibodies in their colostrum to cover those first sort of 9 weeks of calving. So that's going to do the majority. If you've got a really split calving pattern, you might want to sort of split the calves, or split the cows and actually vaccinate them in a split mob. But certainly most of the time, doing it 3 weeks before calving starts is going to be sufficient. So you need one shot. It's a very unique vaccine in that it needs one shot of doesn't need a booster, and so that makes things really, really easy for you. Certainly you should be doing all your herd, and you should actually be doing your heifers as well, because that means that the colostrum that's produced is going to have the maximal amount. What we'd like you to do once you've done the one shot is obviously keep that colostrum and continually feed that for up to 3 or 4 weeks after calving. And what that does is, as I said before, that just provides those local antibodies to the gut to deal with infection that's going on there. So it's about giving them the right amount of antibodies at the start, so good colostrum feeding at the start, but then continuing to feed that colostrum so that you get the local effect of those antibodies. It's been looked at in studies in New Zealand and overseas that actually probably close to 40% of calves aren't actually receiving the amount of colostrum that they need just by being out with their mums out in the paddock. So when you get those calves in, make sure that they've had a good feed. If they look like they maybe are still a bit hungry or need another feed, offer them a feed. With a teat feeder is best, but if they're looking a really bit poorly, then really you probably should need to get in there and actually tube feed them with some good quality colostrum. You can get Rotavec Corona from Veterinarian, and it's actually really good to go on there and talk to them about your calf rearing practices and what you're doing. Certainly they may have some advice if you have issues, and they'll also talk you through basic things like good shelter, a good setup, an all-in, all-out system, and some good hygiene practices. So the vets are a good source of information for you. Use them, and if you do have problems with scours in your animals, then they're the first place to start. Stop it.